Hi, my name is Dr. Hanan Selim. I'm an international speaker, award-winning author, recognized by global gurus as one of the most influential thought leaders in health and well-being. I'm also very passionate about mental health and well-being, and now I'm also working on an amazing project, CEO of Tackle and Talk. So I hope to see you soon.
We are very honored and very privileged to have Dr. Hanan Selim in our little studios today. It's a really special occasion to invite her here. Hanan and I have known each other for many, many years. We've done many things together, and I always remember her as the future of pharmacies, and she is a pharmacist. She even just used to describe herself as a drug dealer, and now she's become a holistic provider of mental health and support and so on. And she's addressing some really critical issues, and her voice into the future is going to be about exactly that, about our voice, her voice into the future when it relates to mental health, burnout, development of human mind, and etc. So we'll be talking about a lot of things. Hanan, welcome. Good to have you here today.
Lovely to be here, Tariq. Thank you so much. Excited, and of course, you're a dear friend. And when you told me to join, I was like, of course. I drop everything and show up for you.
Thank you. No, you're very kind, and your friendship means a lot to me. Thank you.
Same here.
As I said, future pharmacist. That's how I originally know you.
Yes.
What does that mean to you? And can you just share a little bit about yourself on that?
Thank you so much. So yes, I've been in the healthcare industry for over 25 years now, and I came to learn a thing or two about what is the root cause behind the scenes, if you will, of chronic conditions. I worked at the most elite, prestigious hospitals in New York. I was on something called the P&T Committee, Pharmaceutics and Therapeutics Committee, which is a bunch of doctors and professionals coming together, making decisions on critical cases, hard to diagnose, hard to treat conditions, and of course creating the formulary and the medication for that. I was actually also a clinical chemotherapy pharmacist as well in the hospital. So I dealt with a lot of cancer patients, and being in New York and having the best doctors and right in the middle of Manhattan, best research, it was always in the back of my mind, why is it that we are having all these amazing resources, but we always give dire results or diagnosis to patients, like you have 6 months to, for a cancer patient, 6 months to a year to live. Or you have gangrene, even though your diabetes was doing well, now you need to amputate your leg. Or we have patients who are critically obese, not being able to breathe and dying in the ER. So I've seen all that, and it was always in the back of my mind, why is this happening? Why are we not really giving the end results, the medicines, if you will, to tackle these issues? And then fast forward a few years later, I was actually one of the nurses, let's call her Nurse Mercy, because she just had the nurse's hat. She looked like an angel, like a halo with the white outfit. And she walks in and she sees me and she says, "Dr. Hanan, I never thought I'd see you on this side in the bed." What she meant by that was I was the actual patient. I was experiencing endometriosis, precancer cells in my ovaries, and I was about to be rolled into the operating room to have something called a hysterectomy. And of course, she brought the paperwork, and as I was hearing the wheels of the bed rolling, going towards the operating room, I decided to stop and answer that question that I always had from my patients, which is, why is this happening? I was eating healthy. I'm taking care of myself. I'm, the drug dealer, right? So I know what to give myself,
Yeah.
And I stopped it, and I asked her for the paperwork, and it wasn't to sign my life away, as we all do before we go into the operating room. It was actually to sign myself out. And that's how I went on to this journey to understand what is behind the scenes, what is actually happening that is the root cause, causing a lot of these chronic conditions.
Yeah. I think medicine for me needs to be much, much more holistic.
Absolutely.
And I think that's where the world is going.
Yes.
We have a lot of data on hand, and that's also going to help us with a lot of preventive work. Because to me, when we talk about drugs, most problems are being addressed in a curative form rather
Right.
than a preventive form.
Right.
And there, it's a little bit insidious because you've got the pharma, you've got the hospitals,
Yes.
you've got the insurance companies, and you have
Yes.
the food companies. The food
Yes.
companies make you fat, and the pharma gives you the medicine,
Absolutely.
and the hospital look after that, and insurance companies, and they just keep milking the cow.
Yes.
So to me, this whole construct of our healthcare system, which I call sick care system,
Exactly.
is completely wrong.
Right.
This is me being
Right.
very judgmental and opinionated. What are
Right.
your thoughts on it, and how can we address that?
So exactly said. So the first line of therapy till today for diabetes, for example, is a drug that was discovered during World War I. And we're still using it as first line of therapy for diabetes. I mean, we've come such a long way with technology. Look at your iPhone. You know, we're up to iPhone 14 or whatever, but we're standing at a standstill when it comes to healthcare because we're, following the book, if you will, the medical book. And if we go out of the medical book, we get sued or we get, kicked out of our license. And, there's a lot of stuff riding on us as healthcare professionals that we want to stay within the lines, if you will.
Sure, but that's a compliance issue. But more than that, I think it's a money issue.
Yeah.
Because if you're making money on insulin medication or stuff like that, then
Yeah.
you just keep making money.
Right.
Therefore, why change?
Right.
And I think, as a futurist, that we are reaching an inflection point where the world is insisting on that shift.
Absolutely.
And because of data and because of preventive care, hopefully something will change, and perhaps the pharmaceutical firms
Right.
will now start doing something positive to change our world.
And the patients are aware of that.
Yeah.
They're asking the hard questions. Why am I taking this? How long am I going to take it? Am I going to have to increase? Is there side effects? They're becoming more and more aware, and then they're looking for alternatives. What else can I, add? Whether it be diet, nutrition, herbs, acupuncture, all those alternative methodologies, because they want to not be dependent, if you will, on the medication or on the invasive measures.
I've spoken at a lot of conferences and done keynotes for pharmaceutical firms, and they look at us as customers and actually as lifetime customers.
Yes.
My mother was eating Lipitor all her life.
Yes.
My father was having Norvasc all his life.
Right.
Now the doctor, a little bit of hypertension. Oh, you have to take Norvasc. You have to do. And I'm thinking to myself, we are basically being built into lifetime customers, and
Right.
therefore they make money like that. So to reverse that, there has to be a reset, a big
Absolutely.
fat reset.
Yes.
And a friend of mine, Dr. Graham Simpson, he basically says that our own body, and my yoga teacher, Sanjeev, basically that our body is extremely intelligent.
Absolutely.
And nutrition, breathing, simple lifestyle shifts and so on can make a big difference, and that's literally all we need.
Yeah, so there's a well-known doctor, his name escapes me right now. He always said, I've yet to see a patient who goes on 1 milligram of anything and it's reversed, no, it's always 1 milligram, then you go on 2, 3, 4, add more medication because of the side effects, because of increasing the dose and so on and so forth. Yes, absolutely agree. And of course, a lot of the patients, like I said, are becoming more and more aware. And there's that little thing called placebo effect, right? So the placebo, there's no science behind, like let's tick it off to placebo effect and let's not look at it because it's not scientific. There is no research, there isn't any, tangible numbers in black and white that we could measure the before and after. But there is a placebo effect. There is something that's happening to these patients who are able to cure themselves, recover, prevent, if you will. Something happened there. What is it? And that's why part of my journey that I left off with the beginning of the story is that's where I started. Something called epigenetics. Epigenetics says it's not your DNA that predisposes you to disease. It's your environment that you surround yourself physically, mentally, and emotionally that compounds, if you will, and gets you on that journey to that condition.
Indeed. 100 years ago, most of our diseases were infectious diseases.
Right.
Tuberculosis, malaria, and various smallpox, polio, all of these kinds of things.
Right.
Today, 80 to 90% of our diseases are cardiometabolic diseases and self-inflicted diseases,
Right.
cancer, heart disease, etc.
Right.
Most of them are lifestyle diseases. So,
Yes.
so if that's the case, then rather than addressing medicine, shouldn't we be addressing lifestyle and mental health and,
Exactly.
and more comfortable living?
Exactly, and that's why I shifted from being that drug dealer, if you will,
Yes.
and giving out drugs and giving out medicines because
Yeah.
that's what I was spoon-fed, if you will, right?
Yeah.
That's all I knew. So
Yeah.
in my mind, in my heart, and a lot of healthcare professionals, by the way, out there, they're not bad people. They're in their heart doing the best and giving the best care to their patients, trying to have them recover or prevent disease. It's not like, we're just doing whatever and whatever works. No, actually, this is what they studied. I mean, as you and I know, medical school is very difficult to get into and to stay in it. Sure. And continue to educate, and it's continuous learning. Mm-hmm. So they're doing their utmost best, but we also need to also look at that part of the root cause. What is it? There's a questionnaire that needs to be answered, like what is your lifestyle? What are your eating habits? Is there any? Of course, we ask like if they're smokers or any of that, like or history. But we really need to be more specific, deep dive more, and have even perhaps a survey that tackles a lot of the mental health and well-being as well.
Yeah. We are living in a world which has a lot of dissonance, a lot of stress,
Right.
a lot of noise. And that noise is impacting our mental health,
Yep.
apart from our physical health. And I think it's always been there, but I think we're becoming
More.
readier to accept that there is a mental health issue.
Right.
What is your experience, and what are your new things that you're doing around the mental health and wellness space?
So post-COVID, we've come a long way post-COVID because we realized that, oh my God, there's a lot of when you're left at home with your emotions and your four walls, and you just have to deal with it. You can't run away. You can't go make believe you're going to the gym or something, right?
Yep.
You have to deal, and then you have to deal with the spouse or the relationship or whatever. Your environment was there, but we never really focused on it because we was either out running away. We have options, but at that time we didn't have options, and it kind of amplified the issues with the mental health and well-being. As a matter of fact, I mentioned to you a little while ago that there was a research that was done by McKinsey & Co. and EY and PwC on GCC in particular, and they found that we're actually our statistics is double of that of the global, and it ranges from anything from burnout, which includes burn-on, and we're going to talk about that in a minute, to anxiety and depression. And it was kind of an aha moment, like, oh my God, this is actually hitting home. And how do we resolve that? And of course, with the amazing work of UAE, they don't leave anything under the rug, and they actually examine it and make a plan and a strategy to approach it. And that's why we now have the Wellbeing 2031.
To me, it sounds really rather shocking, and I would say almost counterintuitive. We have had the most wealth generation in abundance over the last 25, 30 years. Maybe it is a problem of abundance. We have too much. Right. So we have the highest level of obesity, and now you're telling me, obviously diabetes related to that, and now other diseases that are coming out, mental health problems, anxiety and so on. Why is there anxiety? I mean, everything is cool. We haven't had a war for 20 years. I mean, life is good. Where's the problem?
So let's take Gen Z, for example, right? They have their own issues, their own problems. I mean, I'm Gen X, right? So, and I have Gen Z kids at home. So I'm looking at them, I'm like, they're just lazy, right? But no, quite to the contrary, they're very smart young people. And I think the problem is they have options, and technology is really taking over, and they having the pressure, will I have a future, and let's say in the US, will I have my 401k? Is there something that I could depend on in the future? Because everybody's struggling right now. What about for them, right? And of course, let's talk about also climate change and the other, environmental resources that's also being drained for them as well. So there's a lot of pressure on them for the future. Now, on the other hand, I mean, the stress can be a positive thing. It can be a fuel to push you forward, to analyze, to, be agile, and adaptive. And no, I believe that instead of stressing, how can we evolve? How can we increase or sharpen our saw, if you will, like Stephen Covey says? How can we improve that we are ready for the future, rather than sulk and get stuck in our worries and stress ourselves about something? And I recently I went to actually. About a couple of years ago, Dubai Police had a really interesting conference, and the head of the department said that in a few years, not in the far future, in the near future, there will be even jobs that don't even exist today. So that gives you a forecast of perhaps that the jobs that we might have might be taken away because of technology, but there's new jobs that don't even exist today that we could actually prepare for the future.
There's a study by Dell Computers which said that 70% of the jobs by 2030 do not exist today.
Yes.
So therefore, over the next 7 years, 70% of the jobs will change. So whenever I'm talking to a bank or a technology company or anybody else, I ask exactly this question: what are you doing to bring about the new training, the new thinking, the new leadership structures that we need to have? And it's still lagging. It's still very, very much behind. But do young people consciously get stressed because, oh God, it's really hot and no climate change issues? Or I think that's very subtle and slow. My concern is, why are they? Is it social media? Is that part of the problem? Because to me, social media is an addiction engine,
yes,
and a manipulation engine. That's what it does, to make you an addict, a complete social addict, and manipulate you into doing whatever they want to do. Is that where the problem is, or is there something bigger than that?
I think it's partially that, but I think they feel that they have to be comparing themselves to someone else's timeline. They have to understand that everyone is on their own timeline, right? There's millionaires at 20 years old, and there's millionaires like the KFC gentleman that became a millionaire at 70, right?
Yeah.
Does that make him wrong on his journey and make that 20-year-old right? It has nothing to do. And I think what whether we call it social media or we call it anything else, I think there's a comparison issue. They want to get there faster and quicker, but they need to crawl before they walk, right? And they need to walk before they run. And what I think they're trying to do is they're very creative. They want to create the shortcuts, but they need to also take the time and focus, and self-care also is very important in order to get there faster and quicker.
Sure. You interestingly mentioned the word burnout and burn on and burn in. It's really interesting. What does that mean?
So we're used to burnout, right?
Yes.
We're lethargic, we're exhausted, we're just, we're drained, right? Just like a vehicle, our body is a vehicle. We need to put fuel in there in order to keep going, right? But burn on and burn in is actually becoming a new reality now with Gen Z and everyone. And the best way to describe that is the analogy. Let's say, we're all, when we try to do the buggy in the sand, right? And when we go to the desert and it gets stuck, right? The wheels get stuck, and what do? We rev the wheel up and we're trying to push it out of the sand, but we get, we fall deeper and deeper and we don't go anywhere, right? So that's what I feel everybody is doing, is they're taking a lot of action and doing a lot of things, but they're not really focused on their journey and comparing themselves. And because of the distractions of social media and technology and everything else, I think there's an overwhelm, and then they get stuck. They feel they're not good enough, smart enough, they're just not enough, because they're doing everything and they're just not advancing or getting anywhere. And that's why they get this burnout and burn in that leads to depression, and then of course suicide tendencies, which has really increased in the since COVID as well. The numbers are staggering.
So what are some of the catalysts for suicide? Because I see some of the statistics on that.
Yes.
What are some of those catalysts? Why are people feeling that despair?
So before they actually get to that stage, there's what we call the rabbit hole, right? There's, I think it's a snowball effect, right? First, it might be anxiety or having a hard time, and then the environment stressors get involved, and then perhaps there's a condition, they get a diagnosis of depression, and then then they start to either try to deal with it without the medication, and then they do CBT or behavioral therapy, and then they find nothing is working, and that's actually puts them more and more into the rabbit hole, and then they see blackness. They don't see any avenue, they don't see any light, and of course they feel in their mind and the decision that there's no use, there's no hope, just not live is the answer.
As we look forward, before we go forward, let me rephrase that question. What's your day job right now, and what's your fun job or fun time right now, and how are you combining that together?
So I am still a drug dealer. That's my day job. No, actually, I work at Ministry of Health. I work in the drug department. I'm more of regulations, compliance, not really into the clinical aspect anymore. But my passion and my love is actually, again, ever since that journey on getting onto understanding the root cause, the mental health, and it is through my research for over the last 17 years, before you actually, you mentioned a little earlier, before we actually address the symptoms, right, we have to go back and where it started. What was the root cause? And through my research, we call it epigenetic, Dr. Bruce Lipton, all the amazing scientists that I stand actually on their shoulders today, showcase that it actually starts in the mind. The mind gives the marching orders to release certain chemicals that affect that organ. And it's just like clockwork. It will not deviate. We're all built the same. So might as well go to the mindset, go to the mind where it all starts, which is the subconscious mind, that's giving the marching orders, creating the damage, if you will, to that organ.
I do a lot of work, advisory work on boards and C-level companies of large organizations, and people ask me, as a futurist, that says, what kind of things are you doing? Digital transformation, this, that. I say, yeah, I'm doing all of that. But my number one job is mindset shift.
Absolutely.
And it doesn't, and that's the most difficult thing to do. But that's the primary thing to do.
Right.
And to use a similar analogy in the pharmaceutical and medical space, we have an immune system. Our immune system is there to protect us from anything that's coming from outside. Our immune system is blocking it. Now, companies also have a corporate immune systems. Ministry of Health will have an institutional immune system. So anything coming from outside, new idea, new job, new thinking, there's an instant block. And that's our immune system clicking in and saying, can't do this, never done it before, it's non-compliant, it's too expensive, it's too much of an experimentation, we're not ready for this, and. So our immune system keeps blocking us from progress.
Right.
Do you find corporate immune systems in your business, in your space, are there a lot of blockages in terms of progress?
It's not really, to be honest, all the governments in UAE, they're always giving trainings. We have JAHIZ in Ministry of Health, which is always about, teaching us and becoming aware on Web3. What is metaverse? What is the future? How can we start looking at cryptocurrency? And what is already coming so we are prepared for it? So to be honest, they're actually laying the groundwork to advance. But I think it's not the institution, I think it's the people. I think, and the research shows, right? McKinsey & Co. also looked at all the best employees across all the organizations, and interesting enough, the data that came back, it wasn't their education, it wasn't about their experience, it wasn't about the skill set, it was about one thing and one thing only, and that's their attitude. Their flexibility, or their agility to move forward, because no matter what, you give the context, right, or the content to the person, if they're not ready to take it on and move forward with it, then it's no use, right? So it has to be, the people and the employees have to be prepared, have to have the attitude to move forward.
You do a lot of seminars and sessions. Can you tell us what that is and how you are helping people to bring about this change?
Yes, so I bring my story, I bring my experience, I bring my knowledge. I actually want to move the needle in the right direction and give people hope. Just because you get a diagnosis and it looks grim, or a prognosis and it looks grim, or the doctor says this is the only, no, you have to, you know your body the best, right? Like if, for example, if I give you Augmentin is an antibiotic that is good for the ear infections, for stomach infection, for throat infection. How does the medicine know where to go? No, it's the body's intelligence. When you take the pill, you don't talk to the pill. It's like, okay, I got a stomach infection, I got an ear infection, go there, right? No, you take the pill, and it's not the pill's job. It's the body's intelligence that's going to take where the issue is.
Right.
So we underestimate our health, our body, our mindset, right? Even, you know, what is it? Think and Grow Rich, right? Whether you think you can or think you can't, either way you're right. So it's you that actually have full control of what can and can't happen for yourself.
Most of my presentations, and you've seen some of them, one of the key things that I start with is truth, trust, and ethics. This is becoming 100 times more important. It was always important, but now it's at a premium.
Absolutely.
In your industry, where is trust? Because frankly, I don't trust pharmacies, pharmaceutical firms, because I know they're just making money.
Right.
Unless I absolutely have to, I wouldn't take any kind of medication. I'll take some supplements and things like that, but I avoid it like the plague.
Right.
So I don't trust the institution of pharma.
Okay.
I don't, by definition, I don't trust hospitals. I need to go there for interventions and urgencies, but that's it.
Yes.
So what I'm saying is my trust deficit as far as the health sector is concerned is quite big, and I need to bridge that. We don't trust our media, we don't trust our governments generally, there's a lot of trust deficit.
Issues,
so
yes.
in your field, in your day-to-day work, do you find this gap of trust and truth and ethics in the work that you do an important factor in defining the future?
So actually, as a healthcare professional, before you get your license, before you get your degree, you're actually sworn in on ethics, that you will do your utmost best for your patient, for your client, whatever needs to be, that's in their best interest, not your best interest. Okay, so just saying that, right? But I believe extremes don't help. Completely cutting off, you know, the pharma and industry and the research, right? I think that we should always have a happy medium. Like, you listen to what the doctor or the professionals tell you, right? And they show you the numbers, but at the end of the day, you're the one who's going to sign the paperwork and say, I want this therapy or not, right? So I think more and more people are becoming more aware and more encouraged and wanting to take control over their health and well-being. So I would do your diligence. I would definitely do your diligence, do the research, get your first opinion, second opinion, third, fourth, fifth, even sixth opinion. For me, before I went for my hysterectomy, even though I'm in the industry, I went and got a 10th opinion, right? So I think everyone, you know, is smart enough. You got Mr. Google, right? 9 times out of 10 anyways, it's correct. I mean, you always have to verify stuff on the media anyway, just like you rightly said. But at least you're doing your diligence. At least you're doing, and you know you better. You know your body. You listen intuitively as well and say, this is not right for me. Like I did. Like, hysterectomy is not my cup of tea, because I know I'm going to be on hormone replacement therapy for the rest of my life. I could go into early menopause. I could go into early osteoporosis, and it runs in my family. I was like, no, you know, because I already knew the answers. But for someone who might not know all this stuff, they do their research, ask 1, twice, 2 times, and then you sit with that information and you go inside and you feel, is this right for me?
Right.
Ask the right questions, and trust me, you'll get the right answers.
Interesting. So now you are a voice of the future, and that's the whole purpose of this particular talk. What is your advice to young people when they look into the future, then older people as they look into the future? And there are probably different advices to them. Can you please tell us that, your voice for them?
So I look at the future as opportunity. Some people look at as obstacles. Like, what am I going to do? Technology, ChatGPT. I use ChatGPT. It's amazing, by the way.
But be careful.
Be careful. Yes, exactly.
Because it's only right 90% of the time. So the 10% is huge not to be right.
Right.
So critical thinking and all those other things need to come in. Yeah.
Well, it poses also the question, like if you have to solve a math problem, do you do it with pen and paper? People say, yeah, that's how you're going to be smart. Some professors or some teachers teach that way.
Yeah.
They take away the calculator. But why take the calculator when if you could do something in 5 minutes instead of 10 minutes,
Sure.
right?
I understand that it's ChatGPT is better, but what I think, and maybe I'm old school on that one, you have context, you have experience, you have some degrees and stuff like that, so you have some level of judgment and foundation.
Yes.
Therefore, if it throws nonsense out at you, you say, hang on, this is not. But if a 23-year-old is doing exactly the same thing and saying, oh, I can pass my MD exam through my ChatGPT without context, to me, that's where the issue is.
Absolutely, absolutely. And I just had a conversation 2 days ago with a young lady, amazing young lady, smart. She just graduated university. She was on so many projects. One of them was an intern at NASA. Right, and I was like blown away at her, and yet she's coming to me because she's stuck, that burn on, burn in, if you will. And she applied for this measly job and she didn't get it, and then she got stuck there and she's like, oh, I'm not good enough, maybe I need more skills, I need this or I need that, and she's was all over the place, and of course she didn't move forward. And then when I was just listening to her, I was like, hang on a minute. You just told me about all these projects. First of all, pat yourself on the shoulder, congratulate yourself, celebrate, right? Don't stay there, because then you're not going to grow. And even with failures, you have the right to grieve. But again, don't stay there because you're not going to grow, right? You are, like I said earlier, everyone is on their own timeline, right? You have to step back, examine, realize that, no, I need to celebrate. I am good enough. I am smart. Look, I'm on a project with NASA. I did this, I did that. She was even invited to go to work with the government, out of her country. She's actually in the UK. And I was like, dude.
Yeah, exactly.
Celebrate. I'm hearing you, and I'm at my age, and I was like, wow, I was impressed, right? And yet in her tonality, in her voice, she was just stuck. She was very upset. She was depressed because she didn't get this measly job, and it put alarms on her, oh my God, I have so much work to do, and I'm not there yet. I'm never gonna get there, and of course she gets stuck.
I'll share a personal story with you, which will resonate with this particular comment. I was an extremely successful student. I was a great athlete. I was, well liked, and I had a really happy home life. And my parents, people like us, we need to be either doctor, lawyer, accountant, engineer.
Of course,
and if you're not, you're nothing.
Right.
So I was pushed into doing accountancy, and I was reluctantly, grudgingly, I went into it, and I said, "Oh, it's so boring." And anyway, I went through the first phase, and I got to the final exam, and I failed. The only thing I ever failed in life. That's when my hair started falling. I was 23, 24 years of age.
Wow.
The level of stress and mental breakdown on that, for me personally, was very significant. And I remember telling my parents that you gave me everything. The only thing you didn't train me for is to learn how to fail.
Right.
So because I said, oh, well, I'll just be a failed accountant and nobody will marry me and I'll be sitting on the
you go
left
into
of
this
the
rabbit hole.
Absolutely.
Yeah.
So what I'm saying is, I think part of the training at schools and with parents and in homes has to start being, it's okay to mess up.
Yes.
It's okay to put it down to learning, iteration, development, and not competition all the time.
Right.
So this is how I feel that we need to demystify failure. If you look at parents today, if you are not getting a AA all the time, an A+ all the time, and getting into the best universities and stuff like that, you are failing them, and you're failing yourself. Actually, I think we need to reframe some of these conversations. Anyway, sorry, I just went on a rant there.
No, you sounded like my mother, actually. It's exactly her words. Oh, you didn't get an, when I get an A-, it's oh, why didn't you get an A or an A+? I'm like, that's pretty good, an A-,
That's true. That's true, and that's why a lot of this thing will change. And it's a real pleasure talking to you, and you know, we can
Thank
keep
you
going
so
on.
much.
But coming to the end of this session, I have 2 or 3 sort of final leading questions. Question number 1 would be, what's your advice to people, more grown-up people like us, as we are looking into the future? There are lots of conversations on longevity, conversations on our own mental health and things like that. We've spoken a lot about the youth, but what about the older people? So that's the question number 1 for you.
So I don't mind sharing my age. I'm actually 54 years old. I'm not any woman my age would be either on like hormone replacement therapy, you know, vitamins or galore, or some kind of cholesterol, blood pressure, diabetes, something. And which proves that if we work on our mindset, right, just allow this noise to melt away, right? Focus on you, where you are, that timeline we spoke about. What is your vision? What is your mission? And you stay on your path. Allow the noise just to melt away, and you just focus on you. You'll find you get the right answers. You get people that I've been on my journey, like you, and amazing, wonderful people who just show up at the right time, at the right place. I just am amazed sometimes, and it's like at awe, like, oh my God, how did this just happen? And I just stopped asking that. Because I just, you know, let go and let God, if you will, and allow me to be in the present moment, in the now, instead of in the future, because the 2 things you cannot control, in whatever is in the future and what's in the past. The only thing you can control is now. There's a book called Now, right? Yeah. So, I mean, that's where the control is. That's where your reaction, where your power is to make those stepping stones to the future. And of course, your power is to also learn from your failures, right? We need to learn and leverage, right? Not get stuck there and debilitate us. So, of course, agility, flexibility is definitely key.
Interesting. Last week we met at this women's series for the Netflix program, and I said something which baffled the presenter there. And I said, we are about to enter the golden age for women, because as ChatGPT and robotics and machine learning, all of these things happen, all of the male aspects and the male energy that we need is actually, and the details is being covered by all of this.
Yes.
So what we really now need is humanity, love, intuition, creativity, affection, relationships, common sense, heart, soul, spirit. Absolutely. Guess who's better at that? Women.
Women, yes.
And so you have a natural advantage. And when I said that, she said, my God, you're the first man who's actually framed it in this way. So I'm saying that I am smart enough to try and learn these things, and I have a lot of these myself. Men will catch up. But this is an opportunity for women to take the lead.
Absolutely.
Do you think women are?
Absolutely. Look at the governments. Look, like for
but is your
Ministry of Health is, I would say, 70% women, if not more.
Health and teaching are always women. Okay,
yes.
So I think that's skewed the other way. And UAE is an extreme example of doing it right.
Yes, exactly. It's true.
So therefore, I don't think that's the holistic measurement. That's not the benchmark. It's a good benchmark to aspire to.
It is a very good benchmark. Yes. Yes.
But generally, beyond just specifically that. And that is part of the conversation, is that women are not stepping up. Women are perfectionists. Women have all of those kinds of things.
And I think because we don't have enough role models.
That's true, yeah.
If we have more role models, and I don't mean you have to be a celebrity or a superstar.
But you're a role model. I mean, that's part of the role that you play in the world today.
Yes, and this is why I'm an introvert, by the way. That's why I push myself to get onto the stage, and when I'm on, there's a button that's turned on because it's my passion, and I want people to hear my message, and I want as many women to understand that they are capable of whatever their dreams are, right? And you know, for women, I think we're actually we tell ourselves, you know, we have to compete, and we're not financially as equal, or having the opportunities as men, especially in certain industries. But these are excuses, right? Stop the excuses. Learn what you want to do. What is your passion, and go for it. and see what you can do. You'll be amazed of how far you can come. I mean, if I wasn't able to do it and come away from the drugs and, you know, trying to do, you know, give people medication, and that was the only way of therapy, until I came and understand, like, no, I could do more. I could educate, I could, you know, give the hope and understanding, and step up to, you know, taking control over your health and well-being.
Yeah. Before I ask you my final question, let me speak to the camera. We're talking to Dr. Hanan Selim. We have spoken about everything from pharmaceuticals companies, to youth, to older people, mental health, and how the Ministry of Health and the UAE government is doing exceptionally well in terms of both being forward-looking and also being extremely diverse and encouraging women to rise to the top. Up to 70% of the staff are women. So there are a lot of positives out there. But she also spoke about mental health and about the stresses and the noise that we have in our system. So it's been an amazing conversation covering all of those aspects. Hanan, my final question to you is, if you were to write a letter or a message and you leave it in a bottle and throw it in the sea and we find it 5-10 years from now, what's the kind of message would that be? What would you like to leave behind for your children and for all of us to be able to be inspired by and learn from?
All right, be you. You are enough. Take what your parents told you, what your environments told you, what your teachers told you, and run with it. Don't let it limit you to into a box, trying to follow being this or that. Only, I mean, we all know that each of us is unique. We bring something, even if it's done 100 times, but no one's done it the way you have, right? You know, there's a lot of authors out there, and I could have just said, oh, I'm not going to be an author because there's so many authors. No, that's why there's more and more books being made, right? So I would definitely say you are enough, be you, and go for it.
So you're very optimistic, which is amazing. You have a very forward-looking idea. That was amazing. And you're also looking at the world at a holistic level, which will fundamentally change the future as we see it.
Absolutely.
Dr. Hanan Selim, real pleasure. Thank you
Same
very much
here.
indeed.
Thank you so much,
thanks for being with us.
having me. Appreciate it.